Have you heard? Treating chronic renal failure with gene therapy. As veterinarians know, chronic renal failure is a common illness in geriatric cats and dogs. Deteriorating kidney function is compounded by a catabolic state responsible for many of the complications of this disease, such as anemia and weight loss. The treatment options for these cases are limited and frequently consist of nutritional management and fluid therapy. The options in people are equally limited and are generally composed of long-term dialysis or kidney transplantation. In human medicine, patients treated with recombinant growth hormone showed significant improvements in immune function, anemia, wasting, and other common complications of chronic renal failure. However, the daily injection protocol is not practical in animals. A recent study published in BMC Biotechnology looked at treating chronic renal failure in cats and dogs with growth hormone-releasing hormone plasmid-based therapy. The animals in the study received a single plasmid injection intramuscularly, followed by electroporation. The clinical condition of these animals was then followed over a 75-day period. Electroporation, an externally applied electrical field, increases cell permeability, allowing the introduction of substances directly into cells. The use of this technique has made one-time low-dose gene therapy possible. 30 dogs and 30 cats diagnosed with chronic renal failure based on the results of a physical examination, biochemistry, and a urinalysis were accepted into the study. Additionally, 27 dogs and cats similarly diagnosed were selected as control animals and received fluids, nutritional management, and electroporation without a plasmid injection. Before gene therapy, all of the patients were treated with fluids and specialized diets. Study participants were anesthetized and given a single, species-specific plasmid injection directly into the semitendinosus muscle, followed by 3 electroporation pulses before recovering and being returned to their owners. The animals were evaluated 20, 40, and 75 days after treatment. The results of the study were remarkable. No adverse effects were noted by the animals' owners or veterinarians. Most important, treatment of the growth hormone-releasing hormone led to increased survival times. Treated animals had increased body weight, improved hematologic parameters, increased serum albumin and total protein concentrations, and stable creatinine and blood urea nitrogen concentrations. Overall kidney function was maintained in the treated animals while the control group continued to deteriorate. Quality of life parameters such as activity and exercise level, appetite, and mentation significantly improved in the treated dogs and cats. While gene therapy with the use of electroporation is not widely available in the veterinary field, this study suggests that there are real possibilities for its use in treating severe metabolic conditions and chronic diseases. As examples, previous reports show success with this technique for cancer in dogs and laminitis in horses. Further research may lead to additional uses and eventually provide options for veterinarians and physicians hoping to improve the quality of life for their chronically ill patients.